Okay, we're going to get started. I just want to thank you for being here with us today. This is a huge celebration for St. Bernard's Medical Center, specifically our heart care team. So thank you, all you heart care guys, Cath Lab, for joining us today for this special event. We've been recognized nationally by the American Heart Association with their Mission Lifeline Gold Plus Receiving Award, the highest honor and recognition you can receive for our consistency in response and treatment and the quality of our care for our STEMI patients. We have some copies of the U.S. News and World Report, Best Hospitals Edition. I have them up here with me. If you would like one, you're welcome to come see me after the press conference. Recognizing St. Bernard's as the only hospital in the state of Arkansas to receive the Mission Lifeline Gold Plus Award as a heart attack receiving hospital. Super excited about this. So if you want to see this in writing, please come see me. Dr. Jaime Chavez is an interventional cardiologist with St. Bernard's Heart and Vascular and our physician STEMI champion. He's going to briefly share with you how we got this award and why it's so important for the people in Northeast Arkansas.
Thank you very much, Laura, for that kind introduction. Thank you all for being here today. I'm very pleased to be before you to discuss the merits and the meaning of this moment for this hospital. As I stand before you as Physician STEMI Champion, though, I must say that this award is not an individual award, but it's definitely an award that goes towards everyone that's put in all their efforts, united on a common front to take care of our STEMI patients. For some of you, the word STEMI is something that we hear on an everyday basis, but to others you may say, well, what is that? A STEMI is an abbreviation for ST elevation myocardial infarction, which is one of the biggest cardiovascular emergencies that anyone can have. A STEMI occurs when a heart's artery is 100% blocked, and you can see that manifested by a specific pattern on an EKG. When someone has a major artery that's blocked, the clock starts ticking because the heart muscle is very sensitive to lack of blood flow. And if we don't open up that artery, if we don't open up that blockage, the heart muscle can die. And of course, the patient could also die. So once we have a 100% blocked artery, it's very important to act quickly in order to reduce bad outcomes. And in patients with a STEMI, we have learned that the quicker that we're able to provide adequate treatment, the better off the patient will be. And this award is so important, but because it reflects that we've been doing a fantastic job here at St. Bernard's in taking care of our STEMI patients. I want to outline that this not only tells us that we've been doing a great job locally with our patients that arrive through our emergency room, but we've expanded to provide treatment through our STEMI network to the greater Northeast Arkansas region. We have, in conjunction with other outlying hospitals, outlying clinics, outlying EMS services, been able to expand our region of influence and provide the highest quality cardiac care for our STEMI patients in this region, and we are very, very proud of that today. This process that we are seeing today, culminating with this award, is something that started several years ago with our participation in the Mission Lifeline program. Several years ago, others before me had the desire to elevate the name of St. Bernard's and provide fantastic care to our patients. And we started working with the Mission Lifeline program, and through the last several years, we've risen in the ranks, initially winning the Bronze Award several years ago, the Silver Award in 2014. We won the Gold Plus last year in 2015, and we are now receiving this award for the second year in a row. And we're very proud of this because it shows a consistent dedication to this process. It shows that we've been working hard at this to maintain, to achieve this level of excellence, and then we've continued to work to maintain this level of excellence. And this The way we're able to do this is by constantly refocusing our activities and efforts to always never becoming complacent and always trying to do the best things for our patients. And we're very pleased with this today. I want to tell you that when we look at what we are achieving, we have guidelines that have been established by the American Heart Association, the Door to Balloon initiative that has been instituted. We have as the gold standard of care that when someone arrives with a STEMI, from the moment they arrive at the hospital door to the time that the artery is opened, we would like for the artery to be opened up in less than 90 minutes. That is the national goal. Here at St. Bernard's, we're achieving these times consistently on average within 62 minutes. This goes to show how great of a job we're doing. Not only that, we have expanded our area of influence, and when someone arrives at an outlying hospital and they call us and we immediately accept the patient and have the patient come and be transferred for treatment, we're able to take care of the patients also in a very timely manner. When patients are transferred from another hospital, the goal of treatment is to provide adequate care in 120 minutes or less, and in those cases, we're consistently achieving times of 93 minutes. So we're very pleased with all the efforts we've been doing, because as we take better care of our patients, provide quicker services, and open up the blocked artery in a timely manner, we are improving outcomes by reducing the size of the heart attack, and we're improving the mortality. In essence, we're saving lives with this. And this is something that we really need to be very proud of. As I said, this is a collaborative effort. It takes lots of people in order for this award to become a reality at every level. The institution has to buy into this. So there's leadership that has had to buy into this. The physicians that participate in it, the nurses, the cath lab staff, everyone in the hospital has to buy into this, even from the security guard that holds the elevator open to make sure that the patient gets in and up into the cath lab in a very timely manner. So it's lots of people doing their part to make sure that everything works seamlessly. In addition, it involves the outlying community hospitals and outlying community ERs and outlying community emergency medical services. And we've worked real hard in order to streamline this process. And I'm very proud of what we've achieved. This award is something that, as a community, we should be very proud of, because it's a lot of hard work, and it means that we have these great services available to us. I'm going to tell you two stories without going and speaking too much. I'm going to tell you two stories that I think may give you a framework of what this really means to me personally and what this could mean to us as a community. I've been here personally myself now in Arkansas for 5 years, recently having celebrated my anniversary here at St. Bernard's. And I remember when I first commented to my colleagues that I was coming to Arkansas, the first thing everyone said, "What are you doing? Why are you going to Arkansas? Do they even practice good medicine in Arkansas?" You know, they put there's this idea that we can't practice good medicine here. And that's something that perhaps on a national level it is something that we have to work to fight against. Because when I told my colleagues that I was coming here, I got these strange looks, and they said, "Your efforts are going to go to waste. You know, you're not going to be able to do much good there. Are you sure you want to go to Arkansas?" I've come here and I've seen a very dedicated team, a very dedicated group of individuals working towards a common goal. And today, receiving this award just really solidifies the point that we're doing great things here locally. When I recently went to a national meeting last year, the magnitude of this award really hadn't hit me. But we went to a special STEMI meeting, and we were sitting around a table, and everyone was introducing themselves. And then there was the physician from the bigger states, you know, and then they would say that they were doing all these wonderful things. And then when it came my turn to say, "Well, where are you from?" I said, "I'm from Arkansas." and everyone assumes that we're not doing things right. And then they asked us, so what have you achieved? And I told them, well, we have the Gold Plus Award. And nobody else at the table had the Gold Plus Award. And then immediately, there was a change of tone, because the other physicians at the table said, well, how are you doing this? Could you teach us how we can improve? And immediately, it came to me that if amongst the heart attack care community, this is such a prestigious award, we need to share this locally. We need to tell everyone. We need to share how our successes can impact the community. And what we're doing here in Arkansas, specifically in Northeast Arkansas, is something wonderful, because we're giving people, we're giving patients a chance at continuing to live. And this is something that's magnificent. Life is a beautiful thing. In cardiology, the heart, I can't begin to say the heart is so important. And as long as we can keep our patients' hearts going strong, that's what really moves us and allows us to continually do what we do. And so we're very pleased. If we can change one life, everything we're doing is worth it. But I can tell you, with what we're doing here in Northeast Arkansas, we're changing many lives. And we're doing this on a consistent basis, and we're doing this at an excellent level. And that's something we have a lot to be proud of. Thank you very much.